When you go to the doctor, does your doctor even really look at you? Does your doctor make eye contact with you or observe you? Are they focused on their laptop, doing their documentation, maybe reading reports, typing up their notes, looking at your medical chart, facing sideways, or even facing away from you? If your doctor passed you on the street, do you think they would even recognize you? In this video, I will cover the most obvious cause of vertigo your doctor didn't notice or may not know about. I am the Vertigo detective, Kim Bell, and this channel exists to provide you education, information, and hope, but it is not individual medical advice. The most obvious cause of vertigo your doctor didn't even notice is going to be a forward head posture. You can see it right away if you look at somebody. If you actually look at the person, you can see that their head is significantly in front of their shoulders, especially if you look at them from the side. Now, to be clear, not everyone with a forward head posture has vertigo. So don't mistake that. Not everybody with forward head posture has vertigo. For example, a lot of older adults at my church have gradually developed forward head posture over time with the aging process. And then all of a sudden, seemingly out of the blue, in their 60s or 70s, they started having vertigo attacks that would last for hours. So this can be something that happens over time, the development of a forward head posture, and then eventually results in vertigo with the aging process, but doesn't necessarily always result in vertigo. This is the most easy thing to detect if you just stand next to somebody or sit next to somebody and look at them from the side profile. You can see that their earlobe is in front of their shoulder. And in normal posture, your earlobe should be directly above your shoulder. So somebody with a forward head posture is at risk of getting vertigo later on in life from their neck. To go through the details of this scenario and how this occurs, I want to share with you an article I wrote on this topic. It's on my website called vertigodetective.com, and the topic is called Can Posture Cause Dizziness? So if you go to vertigodetective.com and type into the search over here the word posture, just like that, and then hit the search, this article will come up. So I already did that to set it up here for you. Okay, so many patients I've worked with seem to have forward head posture and dizziness. And in this article, I'll discuss the links between posture problems and dizziness and what to do. So now I'm going to go through this article with you. What is normal posture? Normal posture is when your vertebrae stack like a column. It's called your spinal column. There are natural curves within the spinal column that you can see from a side view, but it should all balance out to be relatively vertical. With normal posture, your head should basically stay stacked vertically on top of your spinal column. Your earlobe should be directly above your shoulder joint when you are sitting up or standing up straight. That is the key. So then if you look at someone from the side that looks like this, where their earlobe, you see this earlobe here is way forward. If I dropped a straight line from the earlobe, it would be up here, okay? Whereas a normal posture, the earlobe should be above this shoulder, right around here. So this person has what's called a forward head posture. If someone stands looking at you from the side, would your head be stacked on top of your spine? That's the question. And that's why this is so obvious, but most doctors don't pick up on it because they don't even look at their patients in a very busy practice. They're just rushing in, looking at the computer, doing their notes, reading reports, and maybe rushing out. It's very special if the doctor actually has time to look at the patient, make eye contact, listen, make a note of what the patient looks like, make observations, and maybe even recognize you on the street. So when your head is level but forward in front of your trunk, that is called a forward head posture. That's what's shown in this video. You can stand normally and ask a friend or family member to take a photo of you from the side. If your earlobe is directly over your shoulder, that's normal. If your head is sticking out in front of your body, then you might have a forward head posture. Now, like I said, not everyone with forward head posture has vertigo, but this would be a risk factor for vertigo in the future. So you want to correct it. With this posture problem, what happens is the low neck, the low part of the neck is flexed forward as if it's bent forward. But then the upper neck, which is right here, is hyperextended. Okay, so we have a hyperflexion of the lower spine and then a hyperextension of the upper cervical area, and that allows your eyes to still look straight ahead with your head level, but it can cause a lot of problems, including dizziness, base of the skull headaches. It can cause ringing in the ears, recurring migraines, BPPV, recurring vertigo spells. There's all kinds of problems this can eventually cause if it's not already. And it definitely causes stiffness in the neck, tension in the neck, and sometimes neck pain. So forward head posture can cause dizziness in a few different ways. As I mentioned, it can cause headaches, it can cause recurring episodes of BPPV, it can cause migraines and even vestibular migraines, it can cause upper cervical related dizziness or cervicogenic dizziness. But one thing that's interesting that a lot of people don't think of is that the spine has what are called proprioceptors in them. These are little sensors within all the joints of the spine, and they tell your body where you are in space in relation to the supportive surface that you're standing on or sitting on. So the spinal proprioception can actually become altered due to forward head posture, and that may contribute to imbalance and even falls in older adults. Also, the forward head posture can affect the blood flow to the brain and the ears, which can cause a baseline of dizziness, lightheadedness, and brain fog. So it can also cause tension at the base of the skull, and then it can cause tension headaches, which are around the top, the sides of the head, or the front of the forehead. Also, some patients with this forward head posture may develop upper back pain. Over time, this can cause wear and tear on the spinal structures and actually damage the spine. So what do we need to do? Well, first and foremost, if you have a forward head posture, but you don't have dizziness or vertigo, be glad for that. And then work on correcting your posture. A lot of times people need to learn how to move their head backwards so that they align their earlobe in alignment with their shoulder. And then a lot of times people need to stretch their chest and strengthen their upper back. So if you can lie flat on your back and your spine goes flat, like your posture levels out, then that means it's not a fixed forward head posture, and that has a better prognosis for resolution through exercise and physical therapy or chiropractic care for the spine. But if when you lie down on your back, if your head drops back and your spine doesn't flatten out, then you might have what's called a fixed forward head posture or a fixed kyphosis, in which case that's not as good of a prognosis for recovery. You can still make improvements, but your spine may never go all the way back to normal posture. In some cases, if they have a fixed thoracic kyphosis, which is a rounded forward head posture that's kind of stuck in place there, they may actually have compression fractures in their spine from that over time, and they may even end up getting a surgery called a kyphoplasty to repair that. That would be determined by an orthopedic doctor or orthopedic surgeon. Now let's take a look at what normal activities can contribute to posture problems. Improper ergonomics. So at a workstation, if you're working on a laptop, a tablet, a desktop computer with a screen below your chin, that can contribute to posture problems and dizziness. If you're straining forward, like the guy that is at the top of this blog, straining forward can cause a relative forward head posture while you're working on your desktop, laptop, or tablet. If you're reclining all the way back while using your phone or tablet, that can cause dizziness and may eventually result in a forward head posture while upright. So these are some examples: improper ergonomics on electronic devices that may contribute to a forward head posture. And sometimes awareness is the only thing we need to fix it. Other times we might need special ergonomic equipment like a laptop stand, different strategies and ergonomic equipment you can implement to improve your workstation can help reduce a forward head posture. Some patients need to get their eyes checked because they're straining, leaning forward on the computer because their glasses are outdated, and that can fix a forward head posture. So you can work with a physical therapist on this, you can work with a chiropractor on this, or some kind of an ergonomics consultant. Some jobs even provide ergonomic consults for their employees. Certain exercises can induce a forward head posture. Most notoriously would be the stationary bike or road biking, where you're hunched forward over the bike with your head level looking out at the horizon in front. That's going to create a relative forward head posture. And people that have dizziness after that type of an activity may benefit from more of a commuter bike or a beach cruiser style where their trunk is upright and thereby their spinal column is stacked while they're biking. Certain hobbies can contribute to a forward head posture, like making jewelry, making ceramics, bending forward, even video gaming, drawing, journaling, playing a musical instrument, even watching sports at a bar, believe it or not. If someone is leaning forward with their elbows on the bar and they're watching TV overhead, that can over time create that forward head posture I'm talking about. Video gaming is notorious. People sitting on the floor, leaning forward towards the TV and looking up are going to eventually create that type of forward head posture over time. So if your neck is bothering you while you're doing your favorite recreational activity or hobby, or while you're lounging around your house or working on an electronic device, then you may need to do some problem solving. If you're getting a headache or neck tension after these activities, then your hobby or your lounging position or your ergonomic setup may be causing posture problems. And finally, I want to talk about sleeping and lounging positions that can cause posture problems. So if you're watching TV in bed like this, or you're working on a laptop in bed while your trunk is reclined and your head is level, or you're even reading in bed or looking at a tablet in bed, all of these can cause a relative forward head posture where, again, the relationship between your trunk and your head is as if you're leaning forward. Okay, and so over time, those type of positions for sleeping and lounging, watching TV, reading, working on electronic devices in bed or on the couch can cause forward head posture, and then in the long run result in dizziness or vertigo attacks. And if you want to learn more about the type of vertigo attacks that are typically associated with the forward head posture, check out this next video.